Morning, folks. Happy Monday. A few things today. So starting out, it's nice that I actually participated in one of these on Friday, that some of the resident committees are starting to get together a little bit, both here and I know at Gate Circle as well under the tent. So at Gate Circle, of course, their tent is right out front, so it's pretty convenient. And then the resident committees for Williamsville are trying to make use of the tent in front of the Lexington Clubhouse. It's a great setting. Obviously, it's across the pond, so it's a little inconvenient, but we're going to use it as much as we can. The residents can certainly do that and work with us on time. The reason that we have to use that tent is because the main tent behind us, is pretty booked up with certainly lunch and dinner, and then also fitness classes, which one just concluded. And then we have cultural arts sessions in the afternoon, so it's great that we're making multiple use of these tent and outdoor spaces during the wonderful weather that we're having this summer, so that we can maximize the resident use for within the community. Excuse me. A couple of the things I want to talk about today. First is, I want to reiterate the visitation policies for skilled nursing and assisted living. We're having, as happens in society, people push the envelope a little bit. And so I want to reiterate the letter that went out at the end of July. Again, visitation for assisted living and skilled nursing is Monday through Friday, from 10 a.m. to 3:30. Only 2 visitors at a time. If people set up a visitation and they bring more than 2 visitors, we're not going to let them visit. People are starting to push that envelope, and please don't do that. Visitation is for 30 minutes at a time. There's designated sites for visitation, especially here in Williamsville. At Gate Circle, we only have, at this point, 2 assisted living residents, so it's really not an issue there. Here, it's an issue. So the visitation sites for assisted living are in the front of Oxford, under the porte cochere, and there's tables set up to keep social distancing, and if people are not following those rules, we will ask them to leave. Same thing for skilled nursing. There's a protocol for that. There's a tent set up in a courtyard behind me, specific access to the skilled nursing residents. And if people are not following the social distance guidelines, people meeting visitors, we're going to ask them to leave. And unfortunately, we've had to address visitors. They just simply can't do it. I mean, there's just too much at stake, folks. If we get something happens and a resident within our health center gets a positive case, obviously the ability for that to spread is multiplied, and then bad things happen. Also, masks. I myself have seen visitors come and sit with their loved ones and social distance and then not wear a mask. If you do that as a visitor, you will be asked to leave, and you will probably not be able to come back. So, I know maybe some of this sounds harsh, but, again, think about what's at stake here. Not only your visitation, but again, if any residents in the health centers come up positive, or a staff member, then all visitation stops for at least 28 days. And that's the best case scenario. Worst case scenario is it spreads within the health center. So please follow the rules, wear a mask, socially distance, 2 people at a time, follow the timelines, and let's keep this a very positive, productive thing, and let's keep extending our opportunities to have these visits with our loved ones. It only takes, obviously, one bad situation, and all this can go away. And, the guidelines or the protocols are our protocols, except for the social distancing, the masks, and there's hand washing stations. Those things are built into the New York State guidelines. So keep this in mind, is the New York State sets the guidelines, we set the protocols around those guidelines. So, I mean, most of this stuff we're not making up, we're just following what the Department of Health has directed us to do. So I go back to this, I implore anybody who's listening to this, who's a potential visitor or has visited the health center, you absolutely have to follow the rules. You can't push the envelope. If we find people that are pushing an envelope, they're simply not going to be allowed to visit. So thank you for that. One of the things I want to highlight today is positivity rates. So I'm sure some of you are following this, and we know that when positivity rates, meaning a percentage of the people that are test positive over an overall population that are tested, reaches above 5%, then that's a big problem. And early on in this pandemic, Erie County was between 5 and 6%, so it was pretty bad, as we know. And since then, it has dropped and dropped and dropped. But I want to highlight the fact that the Erie County, over the last 2 months, their positivity rate has hovered around 2%. Right now, it's just under 2%. So that's good. However, the rest of the state is less than 1%, and that includes the New York City, Long Island area. So I say this because the virus is still heavily prevalent in Erie County. The positivity rate is manageable, but the reality is it's actually higher here by almost a full percent than the rest of the state over the last couple of months. And that should be concerning to everyone. We want to keep it low, and it would be great if it's lower, but it's not. So, and statistically, the people that are getting the cases now, coming up positive, are between the ages in Erie County between 20 and 39. We think that's going to shift a little bit as school opens. It's going to be interesting to see if younger kids test positive with all the testing that will go on in the schools, and if that positivity rate starts to increase in the fall, because that's really what everybody's looking at. Right now we're just under 2. As soon as it starts creeping up, then you will see concern, maybe more hospitalizations, and then concern for the possibility of closing things down, and nobody wants that. So right now, most of the cases in Erie County are between the ages of 20 and 39. I can tell you I have one of those folks that are between 20 and 39 at home. And she's home because she's waiting to go back to college, and she annoys me every day because she's 21 years old. And what do 21-year-olds do in the summertime? Well, it's party time. And party time for a 21-year-old is going to bars and living it up. And my 21-year-old is doing exactly that. Now, she's not doing anything wrong. I mean, that's what 21-year-olds do. That's what I did when I was 21. I mean, Jack, who's here, he probably did it twice as bad. But she also is responsible enough to get that this is part of the issue, right? So her and I have had those discussions, and I think she's being as safe as she possibly can, but let's face it, I mean, that's where the rates of infection are, and we know why. People socializing together in enclosed spaces. So I bring this out simply because of this. Our residents who live here, it's summertime for them, you're socializing with your families as well, and it's awesome. You're going off campus, you're attending parties and graduations, and you'll continue to do that. But keep in mind, your loved ones that are maybe your grandchildren, they're the ones that are where the carriers are at this point, that 20 to 39-year-old crowd. So I say this so that I can continue to push that people need to be vigilant. Hopefully when you're out and about in the community, you're socializing, you're doing it safely, you're wearing your mask. You're encouraging people around you to wear their masks appropriately, and hopefully most of these socialization opportunities are happening outside, because obviously it's the safest way to do it. So, yeah, I mean, try to be safe, try to recognize what the data is telling us, and hopefully we continue to all be safe together and keep this positivity rate low here, or as low as possible here in Western New York. Thank you, and I'll see everybody on Wednesday.